There's actually two ways of having nocebo. The first one is you're part of a study and you have a placebo group where they're given obviously a fake drug, that's a placebo, and they experience side effects, and sometimes even more than the group that takes the regular drug. So that is nocebo. That's something that should not happen, but it's happening. They have side effects, and it's not from the drug. Yes, you mentioned placebo and nocebo. I think nocebo is one that I find really interesting. You just hear from people talking about their experience with the medications, and you don't want to say, no, that isn't real, because that is their experience, right? But sometimes you kind of want to take a look at the data, and you think, well, what is nocebo in the first place? The definition would be, there's actually two ways of having nocebo. The first one is you're part of a study, and you have a placebo group where they're given obviously a fake drug, that's a placebo, and they experience side effects, and sometimes even more than the group that takes the regular drug. So that is nocebo. That's something that should not happen, but it's happening. They have side effects, and it's not from the drug.
So this is a psychological phenomenon. The expectation effect is things we hear talked about, and it's how you can tell that a drug really works is because it's going to be better than giving somebody a sugar pill, but you're telling them they're going to get better.
Exactly. So a placebo is obviously the opposite, where they take a sugar pill, they don't know it's a sugar pill, they think it might be the drug, or they take the drug and they just feel so much better, and it doesn't really quite make sense because it should not work like that. So it's exaggerated in a positive effect, but the nocebo is exaggerated in negative effect. So when you're part of a study and you take a sugar pill and you start describing headache, erectile dysfunction, high blood pressure, it's not from the sugar pill, not a small amount of sugar in a capsule. So that's one way of having nocebo. It's when you're part of the fake medication group and you have all kinds of side effects. And the second way to get a nocebo effect is when you have negative expectations regarding your treatment. You go to a doctor and you get a script for a blood pressure medication. And then, so there are studies that show that when you get informed on the medication, you just get the name of the medication. That's already a 5x increase in side effects. And the one that was studied here was for atenolol, and there were three groups where the first group, they had a 3.1% incidence of erectile dysfunction. All right, so this is a beta blocker. It's for your heart health, and there's 3.1% that have erectile dysfunction.
So if I have a patient comes in, hey, we need to do something for your blood pressure. Here's a medication. I'm not telling them what it is. This is just for your blood pressure. Take this. About 3 out of 100 people have erectile dysfunction.
Right. Although you would say no one does that because it's not like this is your magic pill, and then you go to the pharmacy and the pharmacist is saying, yeah, this is for your heart, this is good, and that's it. It doesn't work like that. But in a non-biased environment where you just take a pill, 3%. Now if you give the medication to the patient, and you just say this is the name, you give the patient sheet, you give the information on the drug, obviously like a regular medication. And then you go and you don't really get much more information. Now you have a 5x increase, like I said, 15.6 of the patients get some erectile dysfunction. So that's already quite a bit. It's just probably people that receive their medication, they kind of look at the sheet and then they see side effects, potential erectile dysfunction, 5x increase.
And that's the one that's going to jump out to people. So they're going to be writing down like, headache, dizzy, I don't care, erectile dysfunction. And then, so if I put 100 people on atenolol and I give them the information, 15 of those people are now going to have erectile dysfunction.
Yep. So that's quite significant. Now, the third group, and that's when you have a conscious, ethical health professional that wants to go through all the side effects and gives all the info to the patient. And they're doing their job, right? And so now the patient is made aware because they would not have read the sheet otherwise, but now they're aware that there is a potential sexual side effect. And what is the percentage here? 31.2%. So that's a 10x increase from baseline, just because now they know that they may have sexual dysfunction. And guess what happens? 1 out of 3, they get sexual dysfunction.
So this drug may cause sexual dysfunction, but if I tell you about that, there's a 10 times higher risk that it's going to happen.
Exactly.
It's really interesting, and it does, you want the patient to take the medication, improve their health. You want the patient to also not have side effects from the medication. So, there's a big psychological component here, like we were talking about at the beginning. So are there some people who are like more susceptible to this? So, placebo non-responders? Is it people that are just very rational and they don't get side effects?
Well, there are optimistic patients that probably will tell you, I don't care, I'll be okay, and they don't read the sheet, and they don't really pay attention when you just tell them there are side effects. Maybe they're like, I'm good, and they're probably going to be part of that first group, 3.1%. Now that's for the optimistic patient, the optimistic ideal patient. Now you have a lot of more pessimistic patients. You also have external factors such as someone else's personal experience with the drug. So they'll tell you, oh, this is really bad for you. So now they get concerned and they're trying to do some investigation. So now you can go online, obviously the internet, with a bunch of people telling you how bad some drug XYZ is for you. The media as well. Now you pay more attention to whatever big pharma company that is making the drug, or whatever horror stories that are out there. And I'm not saying they don't exist, but it becomes a little irrational where you actually go way too far, and now you're probably part of the second group, if not the third group, where you have a 5x increase or a 10x increase, as opposed to the first group where you do have side effects. There are 3% of people that get the side effects, and you can't really do too much about it besides changing the treatment. So you have to report to the doctor, and hopefully the doctor doesn't say it's on your head, because we know that some doctors would kind of invalidate the side effects. So that's probably not the best way to go. So there's also something to be said about health professionals, for sure. But there are strategies to kind of help people that get those side effects. But also a study was talking about some of the patients being predisposed to having more nocebo. So usually the usual suspects having depression, having anxiety, having a more type A personality, neuroticism, and pessimism, where the big five here, with those type of patient profiles, being more predisposed to placebo.
Yeah, I can see that, because a lot of those conditions you already have, some physical symptoms at baseline. The people with depression have a lot of medical comorbidities a lot of times, and they could be having symptoms related to either the depression, to the medical conditions, or to the medication or placebo that they're getting. And I know with Parkinson's in particular, it's a dopaminergic disease, so they do respond better to placebo, probably also to nocebo as well, because I know the dopamine system and then also the endorphin system are heavily involved in that placebo response.
Yeah, that is true. And Parkinson's was one of the disease that I kind of highlighted. So there are a few, let me just pull it up real quick. Parkinson's, they were doing randomized controlled trials with a placebo group, and in a meta-analysis of 3,500 placebo-treated patients with Parkinson's disease, 64.7 reported at least one adverse effect, so side effects from a placebo in a Parkinson's group. And so why is that? Why is it that Parkinson's or depression or multiple sclerosis or epilepsy, those five where they had randomized controlled trial with placebo groups, and they all had more than 50%, if not 60%, if not 74% multiple sclerosis, of those people taking a sugar pill get side effects. And you can probably think that a lot of companies out there trying to have a new medication, or trying to recruit those people, or have a bunch of test subjects, and they may have a bad experience. So that's kind of back to the previous points, where what are the external factors that may be causing a lot of nocebo. And so a lot of the Parkinson's patients, multiple sclerosis, epilepsy, there's a bunch of studies all the time, and if you have a bad experience one time or twice, then that's it. You have a negative lab coat effect. So that's what nocebo is.
Yeah, yeah, I think that's a good point. You brought up, part of that is with the providers and their relationship with the patient. So if the patient, is very skeptical of their healthcare provider, they're going to go home, they're going to do the research. Oh, this medication causes all kinds of side effects. Why didn't my provider tell me about this? And that's going to be a cycle of mistrust. And probably the way to position it is for a provider to say, hey, these are potential side effects that could happen with the medication. Realistically, X percent, 90%, 95% of people take the medication, no problem. But if you do have side effects, let us know.